Hey, what's going on, everyone? Dr. Beau here, Circle of Docs, home of the ambitious chiropractor. Today we're coming at you from a completely different angle in the chiropractic realm. Today I have the CEO of Trigger Point Technology, TPtherapy.com, Cassidy Phillips today here with us. What's going on, Cassidy? How we doing?
I'm good. How you doing?
Doing good, man. Hey, I wanted to bring you on because, as you all can probably see in the product in the background, Trigger Point Therapy is probably the hottest myofascial compression slash foam rolling slash pre and post recovery tool out on the market today. Completely unknown in the chiropractic and medical realm, and a raging success with triathletes, athletes, and anybody in the sports performance realm. So Cassidy, welcome to Circle of Docs. Welcome to the chiropractic side, and I love to just get a good chat going about what TP therapy is all about.
Yeah, definitely. We're proud to be a part of what you've put together. I appreciate it.
No worries. So give me a quick background a little bit. What the heck is TP therapy?
Well, we've evolved into Trigger Point Performance.
Okay.
Started out as TP Massage Ball.
Okay.
Then we went to Trigger Point Technologies, which everybody thought we were a technology company. And then we evolved into Trigger Point Performance. We're a performance therapy products and educational company. What we do is enable people not only to be able to take care of themselves, what we also do is enable doctors to be able to give their patients basically a toothbrush for the body to be able to maintain tissue quality while they're not in the office.
Great. Let's do a little background. This is your baby. You started this company. How did you even stumble upon? I mean, I've got product all around me, guys. I'm sure you guys can see it with it as well. How did you come up with this company or product to start with?
Well, it's kind of an interesting story. I'm that guy. I was the extreme sport guy. I've done every extreme sport that you can think of. It's just in my DNA. I've jumped out of planes. I've done stunts in Hollywood. I've done Ironman triathlons, ultra marathons, skated professionally for rollerblade. I've done everything that I've really wanted to do in the athletic space. Not that I was great at any of them. I was just really good at most of them. It gave me the opportunity to stand at a bar or around the water cooler and tell stories, and I got attention. And, for my ego, that was great. But unfortunately, what happened was my body started to break down, and we couldn't figure out what was going on. I saw every specialist I could trying to figure out what was going on with my body, back specialist. I went the alternative route, where I did vitamin C IVs, glutathione injections, B12 injections, over 300 injections of procaine into my body. I was getting massage therapy at the same time. There's a DC down in Atlanta called Josh Glass, who was really implementing some real deep tissue kind of movement patterns that I was seeing a lot of success with, but it lasted about a day or so. And so they thought I had MS because the tissue quality was so poor and it changed so dramatically, so quickly. And through trial and tribulation, they ended up defining me with having fibromyalgia,
Okay.
which, as we all know, is a dysfunction that takes over the muscle tissue and takes over many people's mind. And is it an autoimmune system? Is it Crohn's? Is it chronic fatigue? Is it depression? Well, it's kind of all of that balled together. So going from the egotistical, adrenaline junkie to strip down of ego and confidence to be basically a zero, I had to understand how to take care of myself. I mean, I think it's the biggest miss, and whether it be sport performance, and when I say sport performance, that's everybody. We all have a sport inside of us. Unfortunately, though, I was forced to try to deal with myself. So I created the TP massage ball first. Now it's been abbreviated to the TP ball. And the concept was I needed to mirror the feeling of an actual hand. I needed to be able to mirror what my massage therapist was doing. I had to be able to mirror what my DC was doing. And at the end of the day, I made that so that it was big enough so I wasn't going to hurt myself. But it was small enough to get into the tissue to allow me to defrag whatever was going on.
Now, the thing that I want to talk about this ball for somebody that's never seen this ball before, it's pretty, I guess you would say, not soft on the outside, but it's enough softness, so it could probably get through and penetrate that top layer of dermis. And then on the inside, it feels quite hard. You know, most people are probably watching this thinking, is it just a glorified tennis ball? And I can tell you, I can't squeeze it like a tennis ball can, so it can work and, you know, get more depth and penetrate the muscle tissue. What's in this thing?
Yeah, well, a tennis ball is made to transfer air from one side to the other to be hit by a racket.
Right.
It has a purpose. It was never intended to massage the body with it.
Uh-huh.
But people are sophisticated enough to come up with an easy equation to be able to duplicate what the therapist is doing. I don't put down, you know, the tennis ball or the golf ball or any of that kind of stuff, because ultimately it's a path to lead to better care. But with our products, the big thing is if you take, you know, one of these, this happens to be our quad baller, and you push, you'll see that there is some movement within the device. And that right there, if you take the same approach here, it's the exact same density.
Great.
So the idea was I wanted to mirror this feeling right here.
Okay.
We patented the products, and what they're made to mirror the feeling of an actual hand. So there's many different fibers within that will ultimately duplicate the feeling of the human hand.
Okay. You know, your patented thing besides the product is something called myofascial compression technique, MCT for short. Now, a lot of people, even myself, when I first started using the product, I took the grid, or your guys' version of the foam roller, and literally just rolled back and forth on it. And it wasn't until I actually attended a class and started learning that I was doing it completely wrong. So what is MCT?
MCT, what we do is you know, I like to take the body through regular ranges of motion that you do in your everyday life. And so what happens is when you get on a table, for most people, whether it be massage, chiropractic, any kind of soft tissue type of treatment, what you see is the limbs are being taken through ranges of motion. You know, you can look at ART, you can look at Graston, you can look at all these different kind of stretch. I mean, there's so many different ways to kind of work through the muscle. But what you typically see is you see the cross-friction massage happen from the external internal.
Okay.
So meaning I'm going to sit there and I'm going to really kind of work the muscle. So I got to work through the fascia. I got to work through the muscle. I got to get into the muscle spindle. To get into that muscle spindle, I'm going to have to put more pressure into the process. So what I decided to do was say, okay, we've got specific products for specific needs. Each product is designed for a different area of the body. But at the same time, what we do, MCT, we take the distal limb through range of motion, we take the device through range of motion, so that we're going to defrag the tissue as you rotate. If I'm going to build compression into the muscle here, as I rotate, if I have enough pressure here, I'm creating an internal type cross-friction massage. So all the muscles, as we know, are supposed to act independent yet as one.
Right. Say that one more time, though, because I think this is a big point that a lot of doctors don't understand, because I'm going to kind of do it over the top here. I'm going to take my TP massage ball. Most docs will just roll back and forth over the top. What you're saying is find a point and then rotate the distal limb around the point to create friction within the muscle tissue, within the muscle spindle.
Absolutely.
Okay.
You know, if you're going to do the superficial top layer quote-unquote massage, you can grab any product out there and duplicate that same feeling.
Right.
When we want to go into the muscle, penetrate the fascia, get into that muscle belly, what we believe is that by just applying pressure, you're not going to yield the return that you're looking for. By rolling on the surface, you're not going to get the return that you're looking for. But if you combine the two, so we're going to lock it down and then rotate, then we're going to yield the return that the individual is looking for.
Absolutely. Perfect. Yeah. I think that's a very big point. And because a lot of docs, I mean, a lot of personal trainers even to this day still have no idea about that. And that is where the gem of what Trigger Point's doing is. You know, guys, I think the thing is that anybody can create product, but having the education, and especially the education that Trigger Point has out there right now. They have videos, I'll pull those up in a minute. They have brochures, I got whole types of manual stuff that you can literally implement in office next day type of stuff. That is where the creativity and ingenuity of what Trigger Point is doing. I want to kind of walk through a little bit of the different products and things that you guys have. So if you could grab the stuff behind you real quick, if you don't mind, CP. Let's go through. You know, I think when you always started, you believe, and I want your philosophy is that you got to start from the ground up, right? Starting with the foot and then working our way up.
Yes.
Okay. How did you come up with that philosophy?
Well, I mean, let's just look at life. You know, what's the first thing to hit the ground at the beginning of the day and the last thing to hit the ground at the end of the day?
It's the foot.
It's the foot, unless you're a drunk, of course, and then maybe, you know. But at the end of the day, yeah, your foot. Your foot ultimately defines the way that you move, but the muscles in the foot control the toes, right?
Right.
So if we're going to go after the way that the foot functions, what we're going to have to do is go after the muscles that ultimately control the foot. So we go to the posterior lower leg, and that's where we define the soleus, the post tib, the flexors, all the muscles in the back of the leg there are going to control the bottom of the foot, right?
Right.
Then we go to the extensors and tib on the front, and then we're going to control the top of the foot. And then, of course, the pronos is on the lateral side of the foot. So the idea here is that if we want you to move, you know, more freely, if we want to take the rigidness out of the foot, we're going to have to go after the way that the foot moves. So we obsess about the area between the ankle and the knee. It's the most critical area, we believe, in order to allow you to have positive biomechanics.
Okay, that's a good point, because that's a little bit different from the chiropractic point of view, where we think, or at least our philosophy is, it's all about pelvis rotation and mobility in the pelvis.
And I agree with that.
Okay.
100%. But you're going to have to go after the foot first, because if the talus is not positioned in the right manner and you're worrying about kind of pelvic stabilization and positioning, if you've got this weight distribution happening here and then the foot and knee aren't able to function properly, well, you go after the pelvis. Once again, I agree, but what we have to clear out there is the psoas, the diaphragm, all of the areas. If you can't breathe, you can't perform, nor can you recover.
Right. This is a really good point. I think this is super important, and why this aligns perfectly with chiropractic philosophy is because we all know that there's 3 areas of the body that deal with balance, structure, and function. Up in our neck, C1, our pelvis, number 2, and then down at the ankle mortise joint of the talus, number 3. So you're going from the bottom up type of perspective. I like this idea.
Well, it's once again, you're the mechanic, right?
Right.
You get in there and get the real work done.
Yeah.
So, you know, all we're doing is we're filling the tires with air. We're armor all in the tires. We're cleaning out the car. We're making sure the car functions properly. But once there's something wrong with the engine, well, you got to go into the mechanic to get, you know, that real work done.
Perfect. Okay, let's talk about this again. So you guys obsess. Let's talk foot up, starting with soleus, and that's where the first product. This is called the footballer. That's what you guys call it, correct?
Yes.
Perfect.
This is the footballer, but it's actually designed for the lower leg.
Okay.
You put it on the bottom of your foot. It feels great. I'm not going to lie. I really enjoy it. But it's not the purpose behind the product. The idea here is that you've got fulcrums and levers at the bottom. Those fulcrums and levers can ultimately be jeopardized because of the muscular structure. Every joint has a muscle and tendon that supports it. I dummy all this down, so you can spice it up with
Great, keep going. Trust me, it's perfect.
Yeah, the dialogue there, but the idea is if the ankle's not going to function properly, the knee has to go forward. If the knee goes forward, the butt goes back. If the butt goes back, then the pelvis tilts. As the pelvis tilts, what happens is you start to arch the lower back. So you put a lot of lordosis in the lower back. Why? Because you're counteracting the weight distribution of life.
Right.
So you create these false fulcrums within the L4-5 area, and then you also do it within the T-spine area.
Right.
So what we've done is the footballer is designed to take care of the lower quadrant. We're going to go after the soleus post-tib region, regain dorsiflexion in the foot. And what I'm going to walk you through real quick is our ultimate 6 areas, if you don't mind.
Sure, let's do it.
So you can understand the concept. We're not just a product. We're a methodology behind the product. So if we address the soleus post-tib region, we're going to regain dorsiflexion in the foot. Now, many times we'll go to the antib, which is in our ultimate 6 plus category. But as we jump over the soleus, then we have to go to quad. So we got to go to rectus femoris, vas lateralis. Now, we are in an industry, and I say that as an athletic industry, not as a chiropractic industry, where we beat our bodies up every day. And so when you have IT band issues, what's the first thing you do? Well, I'm going to beat that up some more.
Right.
And so the connective tissue there can become aggravated, and as you roll on it and continue to roll on it, you never really get rid of the problem. You're addressing a symptom. So we say you want to hit rectus mors, vasa lateralis, regain that pelvic stabilization or control, because we're going to go from quad up to psoas. Why? Because you know why. You know, if we want better hip flexion, but we also want to open up the diaphragm, lengthen the torso, we're going to have to go after the psoas. I challenge everyone that's listening to this, look at the way that you're seated right now. Yep. You know, many of you are going to have elbows on knees, right? So you can't breathe, you can't perform, nor can you recover. But the problem here is that once that diaphragm's closed off and you have poor tissue quality and you're dehydrated, well, all of it's going to stick together. Right. So then we're going to go after piriformis. And as we go after piriformis, why are we doing that? Neuromuscular pathway to the lower extremities, right? We want to increase all of the opportunity there. What will also happen are the knees will splay out. And as the knees splay out, well, then the piriformis is going to bind up. So in order to get that proper positioning of the body, we feel like you're going to have to address piriformis as well.
So this is a good thing, because I think a lot of doctors right now, Thomas Myers and anatomy trains is a big thing. You know, people are talking about working the whole fascial plane or the whole, you know, front and side planes. And in chiropractic, we talk about adjusting through the whole plane. You know, pelvis, knee, ankle, foot type of thing. And this goes right in line with exactly what you're talking about, starting at soleus and then working up through the posterior anterior plane.
Yeah, I mean, if you look at Thomas Myers, what a great guy. He's dedicated so much time to all this research. And you look at, we can go after the lines or the slings. The lines, of course, are going to cross a plane, and the slings are going to really support that torso region. But if you look at the front line, back line, spiral line, you know, the bottom line, no pun intended, here is that the muscles, once again, are to act independent yet as one. Based off of dehydration. That's the biggest evil out of all of this. Dehydration will adhere the body together. And the idea of myofascia is such this mystery. Are you talking about fascia or muscle? Well, we're talking about both. Once again, they're to act independent yet as one. So here's something cool, is if you take your hands, and this is everybody out there, take your hands and just rub them together. And what happens is your hands heat up. That's my version of myofascia. As you become dehydrated and you rub the two together, they're going to get hot, they're going to get sticky, and eventually they're either going to adhere to one another or you're going to rip away any connective tissue between the two. So in order to get that nice space, whereas if you hold your hands together, you can feel that heat on the opposing hand, that's the healthy tissue. So whether you're using Thomas Myers anatomy trains or you're listening to some of Chuck Wolf's flexibility highways, or you're applying the concept that you guys have grown to love, there's the one that I'm most familiar with is ART, which is obviously very tender at times, right? Hard to duplicate on your own. But it's all in this world of soft tissue has to be addressed in order for you as the doctor to see the greatest rate of return, because they have to go home. Your patients have to go home and do something, anything on their own to the soft tissue, because they can't do any kind of a real traditional chiropractic joint manipulation, because it's impossible, really.
So let's talk a little bit about what they would go home with and what they would go home and do. You mentioned briefly, and we talked about a program called your Ultimate 6 or your U6. You know, let's start with the real basics. Let's start with the grid. Let's start with, first off, what is the grid? It's hollow. I don't know if I can put this up and see this to everyone. This is very different than the traditional white spongy foam roll that's out there, or the one with the big pimples of the rumble roller or whatever that's out there as well. What's different about the grid?
Well, there's a couple of things. I left off in the Ultimate 6 pec major, minor, and T-spine, just so that anybody listening, I rattled off a handful of them. I didn't go through all of them. Let me grab one of our grids here so that you can see what the big thing that I want everybody to identify with is this is a glorified meat tenderizer, right?
Looks like it.
Look at it. Yeah, it's similar in nature. And the reason for that is that the defined channels that we built into this thing were to literally push blood and oxygen through the tissue as you roll through it. Now, if you were to take a traditional foam roller, the problem is you pull blood on each side of the roller. So the pain that the client is going through ultimately can be that it's the blood building up on both sides. It may not be the acute pressure built in by the device.
Interesting. So this is helping to return all of the venous flow, the edema, the swelling, all of that.
You got it. It's got to go somewhere.
Yeah.
Right? And so whereas there's other products out there that are concentrating on, we got to get deep in the muscle. For this, I'm less concerned about how deep you get into the muscle, and I'm more concerned with the blood flow and oxygen that's generated as you roll through the muscle.
Okay. Now this is different too, because as you could probably guys see, this is semi-soft, just like the thumb, but it's very hard. This is a big piece of plastic inside. This is my own personal grid that you guys hooked me up with. I've used this for, I think, 4 months now, and it looks damn near exactly like it did day one. It's not breaking down.
Yeah, no, what we wanted to do was come out with a sustainable product that would ultimately allow you to use it on an everyday basis. We have a year warranty on it. That sounds a bit salesy, but it's just a reality.
Yeah.
The thing that I want everybody to understand, traditional foam rollers, where do they end up?
In the trash after 3 months. Yeah.
Foam is one of the worst things for our landfills in the day and age of today. Those foam rollers are made to float. They're not made to massage the body. I mean, look on the side of your boat. You've got one sitting there. Yeah. Look out on you live in California. What do you learn how to surf on first? Roller.
Right.
We're using it to massage the body because the industry said it's a great way to get into it. I never would have imagined that the industry would have stuck with it.
Yeah.
So that's when I made this, and the idea is you've got your fingertip density here, so you get a little different feeling here. You've got your tubular density here, and then you've got these big flat panels. So no matter what, you're either going to get this feeling here, you're going to get this feeling here, or you're going to get the back of the palm of the hand.
Why is this so short? That's the next question everybody's going to ask. This is, I don't even know, 20 inches, something like that?
Yeah, hold it right back where you had it, just there. Bring it back to your chest. Just lower it a little bit so we can see your shoulders. Does it exceed your back?
No.
Is it about the right width of your back?
Perfect.
Yeah, that's it, man. It's the idea is you don't need more to get more. I mean, we as Americans think, man, I need the biggest car in the world, and you don't use half of the car.
Right.
So when it comes to this device, I mean, there's, a lot of people will say, I want to lay it on the spine, right? I want the lengthen of the spine. I want to support the head. So use 2 of them.
Okay.
But you're going to have to engage the pelvic core as you're on top of the rollers. We're going to put a gap in between the 2. Now, we did just make a 2.0 that's longer. And the reason we did that is for the clinical setting. More people wanted that. But at the end of the day, you don't need any more. You want more, but our company philosophy is we're going to give you what you need, not what you want.
Yeah. Okay. Great. So let's put the grid aside. Let's talk a little bit more about different, specific things that you have, because everything comes in packages and stuff like that. Explain how you came up with the packages or the package model and the education that's put in them.
Well, the big thing for me is I never wanted to. One of the big problems that I had when I was going through all of my treatments was I'd go home with a black and white copy.
Yeah.
Off the printer. And I was so unsatisfied because it didn't show me any motion.
Huh.
And so when we started to create the products, the biggest thing that I said was, it's not about the products, it's about the education. Otherwise, what we're doing is we're setting the individual up for failure.
Yeah.
So I want to empower people to be able to take care of themselves. So with that, what I have to do is create educational programming and process. It's just like brushing your teeth. Mm. You brush your teeth every day to keep the plaque off your teeth, right?
Absolutely.
Do you think about the plaque that builds up the rest of your body?
Right. This is a perfect parallel with chiropractic of what we do as well.
So from that perspective is, what the package is, we've got a foot and lower leg kit. Well, that's going to concentrate on the foot and lower leg. We're going to give you more mobility and stability in the lower leg. Now, then we've got our hip and lower back kit. Now, the idea with our hip and lower back kit is we're going to walk from the foot all the way up to the neck, and then we're going to work our way all the way back down to the lower back region.
Okay. Grab that kit behind you and show me kind of what that just kind of looks like, just so the docs that have never kind of seen this put together. Once again, docs, I'm kind of a bit biased in this because this is something I use in my own personal practice every single day. And
this is our Ultimate 6 Plus kit right here, our Ultimate 6 kit. So it comes in a nice bag here so that it's all bundled together. This one has a book and a DVD with it.
Great.
Because people learn in 2 different ways. You either read it or you want to watch it.
Right. So you can literally plug a video in, probably watch you and a couple of models going through all of the different manipulations on the different areas of the body.
Yeah, I mean, the first thing is what we want to do is we want to educate the end consumer as well. There's a certain amount of population that feeds off of every word that you say. And that's like saying, okay, well, we're going to address teres minor right now, and what we're going to do is X, Y, and Z. Most people don't know what teres minor is.
Right.
There's people that say I have IT band syndrome, and they're grabbing their peroneals.
Right.
So what we do is we walk people through a very simple approach to understand, one, how to apply this to your everyday life, how your biomechanics are jeopardized because of your everyday life, and in the end, there is a class that you can follow, but there's also a how-to section. So if you want to go spot to spot to spot, you can actually go into the how-to section to really understand how to use the products in the best way.
Perfect, perfect. You know, I want to speak a little bit about, you guys have really found your niche so far in the very sports performance, elite, athlete type of realm. And as a doctor, I'm sports chiro, that's what I do. I literally have, you know, patients and athletes flooding to my office to learn more about this exact product and how to use it. So how could you see, you know, a chiropractor translating that into practice?
Well, I mean, the one thing, Dr. Beau, that I want you to think about, if time were real estate, what's the one piece of time you don't take advantage of in your clinic?
Time.
Just time in general.
Yeah.
The one piece of time that you don't take advantage of is when your patient's sitting in the front office.
Okay.
Right? That's the one piece of time that I want to take advantage of.
Okay.
If through your initial assessment of your client, you then have an opportunity to take advantage of that time after that first assessment, because you can bring them in and you can have your PA take them through, okay, we have to work through soleus and post-tip before I can even see this patient. And those are billable opportunities. I mean, you're using E-stim and all these other things. This is just another soft tissue solution.
Okay.
Difference is there's an exit strategy here.
Yeah, you can give it to them to take home and do.
Yeah, I'm going to enable you to make more money with that client.
Yeah.
But the reality is, if time were real estate, that one piece of time you don't take advantage of is when they're sitting in the front office. So you can actually have them engaged through that time, rolling out prior to you putting hands on body. So not only are they mentally saying, I am engaged, I'm ready to see the doctor, and I'm not having my time wasted, but if they're sitting up there reading a magazine that potentially has been there for maybe 3 months,
yeah,
you're going to go, I read this last week, kind of frustrated. We're only talking about 10 to 15 minutes.
Yeah.
But for them, that's an eternity.
Right, right.
So we just want to take that mind share so that they're prepping the tissue so that you can go in and do what you have to do once they see you.
Perfect. Let's talk a little bit about pricing and things for the consumer. What does a normal grid cost? What does the different kits cost? Because as the doctor, we're thinking, okay, great, let's get this in every one of our patients' hands. But if it costs $350, then it's probably not going to happen with the majority of them.
Yeah, let me. I don't actually know all the pricing.
Okay.
Got me on that one. The grid it's a retail of $40.
Okay, so exactly the same pricing as what a normal foam roller would cost.
Yes.
Okay.
The difference is we position it so that you can bring it in at half the price of that.
Okay.
So, you know, and we've got different tiers and all that kind of stuff. My sales guys are somewhere going, really? You're talking about sales? You don't know anything about sales. But the reality of the situation is we enable you to be able to make money off the program.
Okay, perfect.
So we have tiered pricing. At the end of the day, you can get 30, 40, or 50% off based on the relationship that you have, meaning how much product you're bringing in and all that kind of stuff. But here's the deal. For a client to be able to bring product into the comfort of their own home, we're talking about a max of $160.
So the price of a pair of new shoes at this point, something like that.
Right. And the new shoes are going to wear out a lot faster than our products are.
Okay.
In order to take advantage of those new shoes, you got to have the body moving in order to be able to use the shoes. I mean, there's so many different parallels that we have there.
Right.
It's not the money.
Right.
It's time.
Okay.
So the way that we got around the money and we address the time is we give them the education.
Perfect.
So we feel like we're giving a product that truly has integrity to that client because we're giving them all the tools they need in order to take care of themselves.
Perfect. Well, let's sum this all up real quick. Okay. So doctors that are looking for a product, a rehab protocol, something to give to their patients that they can do in office as well as out of office, TP therapy looks like it could fit that model pretty well.
Absolutely. You know, the coolest part about our company now, we're 10 years old, so that's surprising to a lot of people. We had a big clinical following in the very beginning because we'd attend all the Ironman events, and Mike Leahy and all his guys, the ART guys, would be getting continuing ed there. So we had a great opportunity there. Now as we've grown, we teach in 40 different countries around the world to not only personal trainers, not only clinicians, but we also teach to the end consumer. So this is a great way to now bring in our products into your clinic, and we market in all of these areas already. Yeah. You might as well take advantage of our marketing efforts, bring our products and programming into your clinic. We are then able to promote that, and we hope that we're going to build you additional business because of that.
Perfect. Hey, Cassidy, I just want to say thanks for, hooking up and talking with us today, introducing TP therapy to the chiropractic world. If you could leave the chiropractic and medical world with one short thing, what do you want to tell us?
Well, the biggest thing I want you guys to understand is we're here to support you. We are an assist. We are not the end-all, be-all, and we know this to be true. We want to be able to offset people that come and use our products. We want to be able to offset them into your clinic.
Perfect.
Because you get the real work done. Perfect. You don't brush. We as individuals, we brush our teeth every day, but we go to the dentist to get the real work done.
Perfect.
You are our dentist.
Perfect. Hey, thanks so much again, Cassidy, for your time. I'm sure there'll be lots of questions. There is already a TP therapy, trigger point therapy group within Circle of Docs. So all of you docs that are watching this right now, go and join the group. There's tons of documentation. There's videos and stuff that are out there. You guys can reach out and get in touch with their sales. Reach out and get in touch with Cassidy. We're here to help you. We're here to connect you with TP. And just say welcome to the chiropractic side of things. So glad to have you here. Thanks a lot, Cassidy.
Yeah, man. Thank you. I appreciate it.
Perfect.